Neet PG Set 7 Questions 151 to 175. Question 151. A 45-year-old man has easy bruising, ecchymosis, and a prolonged prothrombin time and activated partial thromboplastin time. Which of the following is the most likely cause? A. Hemophilia A. B. Vitamin K deficiency. C. Von Willebrand disease. D. Immune thrombocytopenic purpura. Answer. B. Vitamin K deficiency. Explanation. Vitamin K deficiency causes decreased gamma carboxylation of clotting factors 2, 7, 9, and 10, producing prolonged PT and often prolonged UPT. Hemophilia A prolongs UPT only. VWD causes mucosal bleeding and platelet dysfunction. ITP causes isolated thrombocytopenia. Question 152. A patient presents with pain in the right upper quadrant, fever, and jaundice. On examination there is hypotension and altered mental status. What is the immediate concern? A. Acute cholecystitis. B. Acalculous cholecystitis. C. Acute cholangitis with sepsis, suppurative cholangitis. D. Hepatitis A. Answer. C. Acute cholangitis with sepsis, suppurative cholangitis. Explanation. Charcot's triad is right upper quadrant pain, fever, and jaundice. Reynolds pentad adds hypotension and altered mental status, indicating ascending cholangitis with sepsis requiring urgent biliary decompression and antibiotics. Question 153. Which acid-base disturbance is suggested by pH 7.28, PaCO 260 mm of mercury, and HCO3-24 milliequivalents per liter? A. Metabolic acidosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Mixed disorder. Answer. B. Respiratory acidosis. Explanation. Low pH with markedly elevated PaCO2 indicates primary respiratory acidosis. Bicarbonate is normal, so acute respiratory acidosis is likely. Metabolic acidosis would have low HCO3 as compensation. Question 154. A young woman has intermittent episodes of palpitations, headache, and sweating with episodic hypertension. Which investigation is based to confirm suspected pheochromocytoma? A. Serum cortisol level. B. 24-hour urinary fractionated metanephrines. C. Serum catecholamine at single point. D. Plasma aldosterone concentration. Answer. B. 24-hour urinary fractionated metanephrines. Explanation. Measurement of fractionated metanephrines in a 24-hour urine collection is highly sensitive and specific for pheochromocytoma. Plasma catecholamine single samples are variable. Question 155. Which valvular lesion commonly causes a holosystolic murmur radiating to the axilla? A. Aortic stenosis. B. Mitral regurgitation. C. Aortic regurgitation. D. Mitral stenosis. Answer. B. Mitral regurgitation. Explanation. Mitral regurgitation produces a pansystolic murmur-based heard at the apex and radiating to the axilla due to regurgitant flow from left ventricle to left atrium during systole. Question 156. A patient with long-standing gastroesophageal reflux disease develops progressive dysphagia and weight loss. Endoscopy shows Barrett's mucosa with a suspicious mass. The most likely histologic type of carcinoma is A. Squamous cell carcinoma. B. Adenocarcinoma. C. Small cell carcinoma. D. Lymphoma. Answer. B. Adenocarcinoma. Explanation. Barrett's esophagus predisposes to esophageal adenocarcinoma arising from columnar metaplasia in the distal esophagus. Squamous cell carcinoma is linked to smoking and alcohol in the mid-esophagus. Question 157. Which organism is the most common cause of infective endocarditis in intravenous drug users? A. Streptococcus viridans. B. Staphylococcus aureus. C. Enterococcus faecalis. D. Pseudomonas aeruginosa. Answer. B. Staphylococcus aureus. Explanation. A. Psoriasis is the leading cause of IE in IV drug users, frequently involving the tricuspid valve and producing acute destructive infection. Question 158. A patient with long-term steroid therapy presents with proximal muscle weakness but normal creatine kinase. Which condition is most likely? A. Inflammatory myopathy. B. Steroid myopathy. C. Dermatomyositis. D. Polymyositis. Answer. B. Steroid myopathy. Explanation. Glucocorticoid-induced myopathy causes painless proximal muscle weakness with normal or mildly elevated CK. Inflammatory myopathies have elevated CK and inflammatory signs. Question 159. Which of the following is the most sensitive single test to screen for diabetic nephropathy? A. Serum creatinine. B. 24-hour urinary protein. C. Urine albumin to creatinine ratio spot. D. Urine dipstick for protein. Answer. C. Urine albumin to creatinine ratio spot. Explanation. Spot urine albumin to creatinine ratio detects microalbuminuria early and is practical for screening. Dipstick misses microalbuminuria. Chobbi shower collection is accurate but less convenient. Question 160. Which antibiotic is contraindicated in pregnancy due to risk of fetal cartilage damage? A. Penicillin. B. Ciprofloxacin. C. Erythromycin. D. Cephalexin. Answer. B. Ciprofloxacin. Explanation. Fluoroquinolones like ciprofloxacin carry risk of cartilage damage in animal studies and are generally avoided in pregnancy unless no alternatives exist. Question 161. A patient with suspected acute coronary syndrome has chest pain for 1 hour. ECG shows faint elevation in anterior leads. What is the immediate reperfusion therapy of choice if available? A. High-dose aspirin only. B. Primary percutaneous coronary intervention (PCI). C. IV heparin only. D. Thrombolysis at any center irrespective of PCI availability. Answer. B. Primary percutaneous coronary intervention (PCI). Explanation. Primary PCI is the preferred reperfusion strategy for faint elevation myocardial infarction when it can be performed promptly by experienced teams. Thrombolysis is used when PCI is not available within guideline time frames. Question 162. Which of the following is the characteristic histological feature of Hashimoto thyroiditis? A. Lymphoid aggregates with germinal centers and Hurdle cell change. B. Anaplastic giant cells. C. Papillary fronds with often ani nuclei. D. Follicular hyperplasia with scalloped colloid. Answer. A. Lymphoid aggregates with germinal centers and Hurdle cell change. Explanation. Hashimoto (AS) chronic lymphocytic thyroiditis shows dense lymphoid infiltrates with germinal centers and oxophilic Hurdle cell metaplasia, papillary features of a papillary carcinoma. Question 163. Which electrolyte abnormality is classically seen in primary hyperparathyroidism? A. Hypocalcemia and hypophosphatemia. B. Hypercalcemia and hypophosphatemia. C. Hypercalcemia and hypophosphatemia. D. Hypocalcemia and hypophosphatemia. Answer. B. Hypercalcemia and hypophosphatemia. Explanation. Excess PTH increases bone resorption and renal phosphate excretion, raising serum calcium and lowering serum phosphate. Question 164. Which of the following causes macrocytic anemia without neurological symptoms? A. Vitamin B12 deficiency due to pernicious anemia. B. Folate deficiency. C. Copper deficiency. D. Iron deficiency. Answer. B. Folate deficiency. Explanation. Folate deficiency causes megaloblastic anemia but typically lacks the neurologic manifestations seen with B12 deficiency because folate does not affect myelin synthesis. Question 165. A febrile neutropenic patient should receive empiric broad-spectrum antibiotics that cover which organisms? Primarily, A. Gram-negative bacilli including Pseudomonas and gram-positive cocci depending on setting. B. Only anaerobes. C. Only gram-positive cocci. D. Only viral coverage. Answer. A. Gram-negative bacilli including Pseudomonas and gram-positive cocci depending on setting. Explanation. Empiric therapy for febrile neutropenia must cover Pseudomonas and other gram-negative bacilli. Antipseudomonal beta-lactam agents are first line, with gram-positive coverage added based on clinical features. Question 166. Which of the following is the best initial test to evaluate suspected Cushing syndrome? A. Morning serum cortisol. B. Overnight low-dose dexamethasone suppression test. C. 24-hour urinary free cortisol. D. ACTH stimulation test. Answer. B. Overnight low-dose dexamethasone suppression test. Explanation. The overnight low-dose dexamethasone suppression test is a sensitive initial screening test for endogenous hypercortisolism. 24-hour urinary free cortisol is also used for confirmation. Question 167. A patient with acute severe asthma in the emergency department has rising carbon dioxide tension on arterial blood gas. This indicates A. Improving ventilation. B. Respiratory muscle fatigue and impending respiratory failure. C. Metabolic acidosis. D. Hyperventilation. Answer. B. Respiratory muscle fatigue and impending respiratory failure. Explanation. Rising PaCO2 in an asthmatic patient suggests hypoventilation from muscle fatigue and diminished respiratory drive, signaling need for urgent escalation including intubation. Question 168. Which organism causes granulomatous inflammation with non-calciting granulomas commonly in lungs and mediastinal nodes? A. Mycobacterium tuberculosis. B. Histoplasma capsulatum. C. Sarcoidosis non-infectious. D. Nocardia asteroids. Answer. C. Sarcoidosis non-infectious. Explanation. Sarcoidosis causes non-calciting granulomas in multiple organs including lungs and lymph nodes. TB produces C-acceting granulomas. Question 169. Which of the following is the drug of choice for long-term disease-modifying therapy in rheumatoid arthritis? A. Prednisone alone. B. Methotrexate. C. Naproxen alone. D. Paracetamol only. Answer. B. Methotrexate. Explanation. Methotrexate is the anchor DMARD for rheumatoid arthritis due to efficacy in slowing disease progression. Steroids and NSAIDs provide symptomatic control but are not primary DMARDs. Question 170. A patient presents with painless jaundice and weight loss. Which is the most likely diagnosis? A. Acute viral hepatitis. B. Gallstone obstruction of common bile duct. C. Head of pancreas carcinoma. D. Hemolytic anemia. Answer. C. Head of pancreas carcinoma. Explanation. Painless obstructive jaundice and weight loss are classical for carcinoma at the head of pancreas causing extrahepatic biliary obstruction. Question 171. Which of the following conditions is associated with periorbital purpura, raccoon eyes, and conjunctival hemorrhages? A. Amyloidosis UL. B. Hemophilia A. C. Idiopathic thrombocytopenic purpura. D. Scurvy. Answer. A. Amyloidosis UL. Explanation. Light chain amyloidosis can cause fragile blood vessels and periorbital purpura. Conjunctival hemorrhages may occur. Scurvy causes bleeding gums and petechiae but periorbital purpura is characteristic for amyloid. Question 172. Which of the following is true regarding difference between delirium and dementia? A. Delirium has gradual onset and is irreversible. B. Dementia has acute onset and fluctuating course. C. Delirium has acute onset and fluctuating attention and is often reversible. D. Dementia is always reversible. Answer. C. Delirium has acute onset and fluctuating attention and is often reversible. Explanation. Delirium features acute onset, fluctuating course, prominent attentional deficits, and often reversible cause. Dementia is chronic, progressive, with insidious onset and relatively preserved attention early. Question 173. A child presents with fever, lymphadenopathy, and an erythematous sandpaper rash with Pasteur's lines. Which organism is the cause? A. Staphylococcus aureus. B. Streptococcus pyogenes group A Streptococcus. C. Conbacterium diphtheriae. D. Haemophilus influenza. Answer. B. Streptococcus pyogenes group A Streptococcus. Explanation. Scarlet fever due to streptococcal pyrogenic exotoxin presence with fever, pharyngitis, sandpaper rash, strawberry tongue, and Pasteur's lines. Question 174. Which of the following is the most appropriate initial management of tension pneumothorax in a prehospital setting? A. Immediate needle decompression in the second intercostal space mid-clavicular line followed by chest tube placement. B. Supplemental oxygen only. C. Immediate intubation before decompression. D. Observation and analgesia. Answer. A. Immediate needle decompression in the second intercostal space mid-clavicular line followed by chest tube placement. Explanation. Tension pneumothorax is life-threatening. Immediate needle decompression relieves intrathoracic pressure emergently, to be followed by definitive chest tube placement. Question 175. Which cranial nerve is most commonly affected first in herpes zoster shingles involving the face? A. First division of trigeminal nerve V1, ophthalmic. B. Second division of trigeminal nerve V2, maxillary. C. Third division of trigeminal nerve V3, mandibular. D. Facial nerve VII. Answer. A. First division of trigeminal nerve V1, ophthalmic. Explanation. Herpes zoster commonly involves the trigeminal distribution, with the ophthalmic branch frequently affected. Zoster ophthalmicus threatens the eye and requires urgent antiviral therapy.